Start.
Rolling, yeah, you're good.
Hello, hi, good morning. This is Dr. Yang at Dental Chicago. We have a lot of patients, they are asking about what is emergency dental service. Today, I'm going to answer some of the questions to make you understand better about emergency dental service.
What qualifies as a dental emergency?
What qualifies the dental emergency service? So first of all, if the patient experiences an toothache or abscess, or because of the accident tooth become mobile, loose, or even the denture fracture or chipping or like come out one denture tooth, which cause need to get immediate dental service. So we call those type of the situation needing the emergency dental service.
What should I do if I lose a tooth?
If you lose a tooth, please call dental office right away. If it's due to the accident and then you need to call dental office, then meanwhile you need to try to save the tooth, okay, improperly. Number one, if you have milk, you can put the lost tooth into the milk, or you can just simply put that tooth back into the socket, or even put in your mouth, hold under the tongue, and then go to see the dental dentist. It is very, very important you do timely treatment on the tooth, so this tooth maybe can put back into the socket, especially for the young kids. And if you have the tooth come out because of it has been loose for long, and in that case it can be due to the gum disease or some other situation. In that case the tooth may not be savable. So anyway, you need to go to see the dentist to see if we can do something to help you get a temporary tooth so you can go outside for the social.
Can you treat a broken tooth in one visit?
Can you treat a broken tooth in one dental visit? This is a good question. It's depending on the situation. The situation one is if you get a fracture or chipping, which is very shallow, it's not deep into the pulp or nerve. So in that case, yes, we may be able to repair the tooth with composite bonding at one visit. However, if the tooth get fractured and the fracture go into the nerve, so in that case, we may need to schedule you see the endodontist, which in our office we offer this emergency care. So you need to get root canal treatment before we restore the tooth. But likely we can give you that service on the same day to get the root canal treatment done and also get a temporary filling or crown, so then you can look good. And however, if you have the tooth fractured on the same time, or the tooth get dislocated and malpositioned, so in that case, that means the teeth need to be put back into the right position, and then we may need to observe until a couple weeks later to do the root canal treatment. It's really depending on the situation and also the experience of the dental office, how to handle this dental emergency with a multiple specialty team.
How do you handle dental emergencies after hours?
How do you handle the emergency dental service out of hours? So this is in our office. If for the existing patient, we may patient have our contact, they may call us and then text us so that we can know their situation. Normally on my phone with the Weave system, I can see the message from my patient even after hours, and that will give me the notification. So in that case, I can quickly check the patient records if the patient has any allergy or any complicated medical situation, so then I can call or text them back about how to properly handle that situation or give them antibiotics or painkiller. However, if it's a new patient, I never seen this patient. If patient has this emergency dental care service request, so I may check and then do a tele-dentistry, give them a quick phone call and to check what's the situation they have to help them, emergency care. So I can try to do that as soon as possible, and then we will schedule the patient on the next day to see, to see them, so to give them proper treatment.
What can I do to manage severe tooth pain at home until my appointment?
So this is a very, very good question. How do you handle the severe tooth pain, right? So it's depending on what is the situation. If you have a decay for a while and then now you get a toothache, so very likely it's the nerve, get affected or infected. So in that case, you can use painkiller, for example, 600 or 800 milligram ibuprofen, or even Tylenol 500 milligram. Just remember, you need to take those medication after the meal, okay? And then if you don't have caries or you go to see the dentist very routinely and you never know, like you get a decay, so that could be the tooth get fractured. When the fracture go into the nerve or go to the root, so with this toothache, so you can take the ibuprofen and or Tylenol that help you. So then if you don't have any, decay or you don't grinding the teeth, you may not have some like a tooth fracture risk. And for the senior people with severe toothache, you may need to be alert in case sometimes early symptoms for heart attack can be the toothache. So in that case, I would probably, take a Tylenol or go to see emergency, because if it's a heart attack, that cannot be delayed. So I would say go to the dental emergency. So that's why it's for the young people, and the decay or tooth fracture could be more like a common. For the older senior people, especially if you have a heart disease, you need to be careful. Toothache can be the early symptoms for the heart attack. So in that case, go to see the emergency or urgent care. That's very important. If it's a tooth source, take ibuprofen or Tylenol. Here, another one small tip. You can also, for the infection or abscess toothache, abscess related toothache or deep decay related toothache, you can also use warm salt water and hold for 1 or 2 minutes. That can help you reduce the infection and help you to control the toothache. That work pretty well. If you take ibuprofen and Tylenol, you can alternating them to reduce the side effects. For example, you can take ibuprofen 600 milligram. 3 hours later, you can take Tylenol 500 milligram, and then after another 3 hours, you can take a Tylenol, ibuprofen again. So that is alternating ibuprofen 600 milligram and Tylenol 500 milligram every 3 hours. So in that case, you may get the best control with pain, toothache, so at home for yourself. Thank you so much. Today, I hope I answer most of the questions about emergency dental service, and our office can offer at a multi-specialty level emergency handling, like a team and the system. So if you have any emergency or if you have any question, please call us 312-929-4783. Thank you.